You wake up. The day hasn't even begun, and you already feel it. That dull, familiar pressure behind your eyes. The slight throbbing in your temples. You take the blood pressure pill you've been taking for years. You sit up, put the cuff on your arm, and wait. The machine squeezes, and then shows a number. 164/98. Again, a wave of disappointment. Helplessness washes over you. You cut back on salt. You try to be good, but the number doesn't change. You think to yourself, this is it. This is how you get old. Tired, foggy-headed, and waiting for the big one, the heart attack or stroke they keep telling you about. Your independence, the life you've built, seems to be slipping away, one by one. What haunted me about my patient, Frank, wasn't his medical history. That day, he, a 70-year-old retired mechanic who had spent his entire life tinkering with his hands, sat in my office and said, "Doc, I follow the rules. I take my pills. Why am I only getting worse? I feel like a prisoner in my own body. I'm a doctor. I've been treating patients like Frank for over 30 years. And I'm here to tell you that this entire debate about high blood pressure is broken. We've been fed a series of destructive myths that keep people sick, afraid, and dependent on pills that often don't even solve the problem. The belief that one number on the bottle is the only answer. The idea that a silent killer means no one will warn you. The lie that after 70 your body is too old to heal. These myths are what's truly dangerous. Today, we'll debunk them one by one and replace them with a concrete, actionable plan. This isn't just theory. This protocol helped Frank go from a blood pressure of 164/98 and a life of fear to a blood pressure of 118/76, giving him a vitality he hadn't felt in 20 years. It's about addressing the root causes, not just masking the symptoms. Because after 60, it's not high blood pressure that steals your life. It's the lack of specific, tangible steps to overcome it. Stay with me. This is the conversation your doctor never had time for. By the end of it, you'll have a clear, step-by-step plan. This is a myth I hear every day. People are told, your blood pressure is a little high. Take this pill. They take it, and if it doesn't go down, they increase the dose or add a second pill. The root cause is never addressed. The patient feels lethargic, tired, and depressed. The problem isn't the medication itself. The problem is using the medication as the only tool. Correct. Medicine is a tool. It's not a strategy. Think of your body as a house on fire. High blood pressure is like a smoke alarm. Taking a pill without considering lifestyle factors is like simply putting out the alarm. The fire is still burning. Frank's first medication was a simple diuretic. It helped a little, but left him feeling exhausted and dizzy. It treated his body like a typical 70-year-old, not Frank as an individual. The first step was a thorough examination. We didn't just look at blood pressure, we looked for the cause of the increase. We ran a simple blood test for renin and aldosterone. This tells us the underlying cause. Is it due to fluid volume or vasoconstriction, the narrowing of blood vessels? Frank's renin was high. The problem wasn't excess fluid, but rather that his blood vessels were clenched like fists. The diuretic proved inappropriate. It dehydrated him and further constricted the vessels. So, the first concrete action was not to blindly accept the prescription, but to request specific tests to identify the underlying cause. Exactly. We switched Frank to a different class of medication, angiotensin II receptor blockers, ARBs, which specifically stimulate blood vessels to relax and open. Within a week, his levels began to steadily decline, and the brain fog and dizziness disappeared. The key to his lock had been found. But the medication was only the first step. It became a lifeboat that kept him safe while we taught him to swim to shore. The real healing began with the next steps. Doctor, the second most common myth is that lifestyle changes are vague and ineffective. Patients are told, eat better and exercise. This is useless advice. It's not a plan. We gave Frank precise, military-style instructions for his body. Let's be specific. The first pillar is nutrition. We didn't say, eat less salt. We gave him a numbered system. Sodium-potassium flush. The goal is not only to lower sodium levels, but also to significantly increase potassium levels, which acts as a natural diuretic and vasodilator in the body. His goal was 4,700 milligrams of potassium per day. He achieved this with two specific, measurable actions. Eat one large baked potato with the skin or one large sweet potato every day. This alone provides nearly 1,600 milligrams of potassium. Eat 2 full cups of raw spinach or 1 cup of cooked spinach every day. He blended it into a morning smoothie with half a banana and water. This added another 1,200 to 1,400 milligrams. Eat 1 avocado every day. This added another 975 milligrams. This simple, repeatable protocol ensured he was getting blood pressure-lowering minerals without having to count a single milligram. Boost nitric oxide levels. Stiff arteries can't relax. We need to open them up. We prescribed one specific food. Eat 1 full cup of raw, grated beets every day. He added them to salads. The dietary nitrates in beets are directly converted into nitric oxide in the body, a powerful gas that causes blood vessels to dilate. Blood pressure drops within hours of consumption. Studies show a consistent reduction in systolic pressure of 4 to 10 points with daily beet consumption. Thick, inflamed blood pumps poorly. Take 2 grams of high-quality omega-3 fatty acids, EPA/DHA, from fish oil daily. This naturally thins the blood, reduces plaque instability, and reduces systemic inflammation. Use extra virgin olive oil as your only cooking fat. Polyphenol restore the endothelial lining of arteries. This wasn't a diet. It was a prescription. It was specific, measurable, and left no room for doubt. Frank didn't have to wonder what he ate. He had a checklist. The third pillar was movement. We didn't say, go for a walk. We prescribed specific exercises. This is critical. The wrong type of exercise can dangerously raise blood pressure. We focused on isometric grip training. Protocol: Frank bought a simple grip machine for $10. He would squeeze it with one hand at 30% of his maximum force for 2 minutes. Then he would rest for 2 minutes. Then he would switch hands and repeat the exercise. He did this for a total of 12 minutes, 3 times a week. Isometric grip training creates a remote ischemic preconditioning effect. It tricks the body into thinking a limb is experiencing pain, which then triggers a systemic release of vasodilators that lower overall blood pressure. Peer-reviewed studies show that this simple protocol can reduce systolic pressure by an average of 10 to 12 units. It's one of the most powerful, yet underutilized, tools available. We also recommended slow, controlled breathing. Twice a day, Frank sat quietly, breathing in through his nose to the count of 4 and out through his mouth to the count of 6. He did this for only 5 minutes. This simple action activates the parasympathetic nervous system, the rest and digest system, which directly signals blood vessels to relax and slow the heart rate. This is a direct pharmacological intervention without the use of drugs. The fourth pillar is sleep. It's not about rest. It's about maintaining vascular function. We were treating his lung while he slept, which he didn't even know he had. Every time he stopped breathing at night, his blood oxygen levels dropped sharply, and his nervous system panicked, spiking his blood pressure. With a simple dental device, his blood oxygen levels returned to normal overnight, and his morning blood pressure readings dropped 15 points practically overnight. If you snore or wake up tired, you should have a sleep study. The fifth pillar is hydration. Frank drank half his body weight in ounces daily. For a 175-pound man, that's 2.7 liters. Chronic, mild dehydration makes the blood thick and sticky, forcing the heart to work harder. He kept a liter-sized bottle on his desk and made sure to drink 3 of them before bed. It was a complete protocol. It wasn't vague. It was a set of technical demands on his body. We monitored his data weekly. We adjusted the plan based on the numbers. After 3 months, Frank was completely off one of his 2 medications. After 6 months, his blood pressure was stable at 118/76. His doctor, whom he'd been seeing for 20 years, looked at his chart and said, "I don't know what you're doing, but whatever it is, don't stop." Frank looked at him and said, "I don't know, because for the first time in 10 years, I finally feel in control." He's no exception. He's a case of a man who was finally given the specific, actionable instructions his body needed. The body is a machine that follows the laws of physiology. Give it the right commands, and it will heal at any age. The message is this: your destiny isn't in a bottle of pills. It's in your daily habits. It's in the food you choose. You pay attention to how you breathe, what water you drink, and what specific, purposeful movements you perform. You have the power to change the readings of this device. It all starts today. It all starts with one specific action. Eat a baked potato. Add some beets to your salad. Squeeze a resistance band for 2 minutes. Breathe slowly for 5 minutes. This is the path to your life again. This is how you will regain your independence.